Hello everyone and welcome to my channel. In this presentation, I will continue covering performance domain number 1, and the next topic is assessment. An assessment is an ongoing process to evaluate our client's treatment plan and their progress in treatment. Since there are different assessment instruments, we must select the most appropriate one based on age, gender, racial and ethnic background, and disabilities. The assessment should be culturally relevant, so we must take into account our client's culture. We must be aware of how clients report their difficulties. Clients may have different ways of expressing their distress, and these ways are particular to the client's culture. So we want to become familiar with different expressions in the language or their body language, and that helps us understand our client and build rapport with them. Why do we gather this information? Why do we do an assessment? After the screening process, when we determine that our client is eligible for treatment, we need more information to develop the treatment plan. So we need history of alcohol and drug use, physical and mental health, addiction treatment histories, family issues, work issues, history of criminality, education and basic life skills, socioeconomic situation, current legal status, level of readiness for treatment, and level of cognitive and behavioral functioning. In order to build rapport with our client, we need to use procedures that will encourage the client to feel in a trust environment and in a safe environment to share their information. They need to know what the purpose of the assessment is and why we need that information. Clients are they're more likely to cooperate with the assessment process when they know the reason for this procedure. Also, when explaining the assessment results to the client, we should use non-technical language. So that means you want to use language that your client is going to understand. And avoid using words like alcoholic. You want to say a person with an alcohol disorder. And you also want to say a person with schizophrenia instead of schizophrenic. The assessment requires extra training in order to learn how to analyze and interpret the results. An accurate interpretation of the results leads to determining treatment recommendations, modifications to treatment plans to better meet the client's needs, identifying what is really working, and better ways to make the client more involved in the treatment process. When the counselor's assessment identifies a potential mental health problem, an appropriate referral for additional assessment should be made. So just keep in mind that you need to make a referral when things that are outside of your scope of practice happen. And the assessment is very important to show you if the client is going to need referral to other services in the community. It is our responsibility to use these instruments appropriately and recognize when we need assistance from our supervisor. This is the end of the presentation. Thank you very much for watching. The next topic is engagement. Don't forget to subscribe and follow me. Visit my website at lcdcexamreview.com, and thank you very much for watching.